So we've seen on the one hand consolidation among health insurers, hospitals on the other side, and of course the entry of private equity into healthcare. Uh, One of the stories that we ran this past week was about the devastation, really, of hospitals in Massachusetts that are part of the Steward Healthcare. They also have some hospitals in Texas. Uh, but those hospitals were acquired some years ago by private equity, and uh, the hospitals were saddled with debt, and they're just a shell of themselves now, and they're barely able to keep the doors open. It has become quite a crisis in a lot of cities. But what we have seen a lot of in private equity buying hospitals and some physician practices has led to just the ruination of those hospitals and those practices. And I had the privilege of working with Mariana and John and others in New York last year at an ongoing basis, pushing back against the mayor and the administration up there, trying to herd all municipal retirees into a Medicare Advantage plan. More than half of Medicare eligible people are now enrolled in a Medicare Advantage plan. They, for the most part, have no clue what they're getting into when they enroll in these plans. They're sucked in by commercials featuring Joe Namath and many other former stars and celebrities who talk about just how much of how good it would be for people to enroll in Medicare Advantage plans, because you get some discounts on gym memberships and some coverage for vision, dental, and hearing. It's not adequate coverage, but it is something. And sadly, those are benefits that are not part of traditional Medicare. And that's something that my colleagues and I advocate for and work for in Congress, is to try to see if we can put the traditional Medicare program on an even playing field with these private companies that have just really been raiding the Medicare Trust Fund, overcharging taxpayers by the billions of dollars every year, and making money hand over fist. And one of the ways they do that is denying and delaying care. Another area that's related, that is a big focus of our work, is prior authorization, and that is a practice within health insurance companies, including Medicare Advantage plans, in which the insurance company, some bureaucrats somewhere, will make a decision to overrule what your doctor says you need and refuse to pay for your needed treatment or your medication or imaging. And it's become extraordinarily difficult for many people to fight back against this. A lot of people don't know that they have the ability to appeal. So consequently, and it's complicated to appeal. Most of the denials are not challenged, and so people wind up not getting the care that they need. In many cases, going to early graves because they're not getting the care that they need.